Hi, everyone. My name is Dr. Tejal Pandya, and I'm here with a good friend and patient of our practice, Miss Judy Trimble. Thank you so much for joining me today and coming to share your experience and your story with your reflux.
I'm happy to.
So, Judy, can you tell us about your experience, kind of in general, with reflux, because you're someone that suffered with those type of symptoms before, had anti-reflux surgery, and so you've got kind of a before and after in your life. So can you tell us what it was like before you had your surgery?
Well, I had been using acid blocking medications for 5 or 10 years before I investigated the having the surgery, and I found that my bone density was going down, and I started reading about it and realizing that acid blockers also affect absorption of minerals. So it seemed to me that it's common for bone density to become a problem when you block acid for years on end. So I happened to speak to another patient of your dad's, and she highly recommended it.
Mhm.
And we talked about it. They told me about the surgery, and so a few months later, I decided to explore it and ended up having the surgery.
Did you have changes with your bone density that you were seeing on test results from your other routine healthcare?
Yes, it was tending towards osteopenia. I was doing a bone density test every 2 years, and it was going down, and it didn't seem like it should be because I would exercise, and so I nobody ever really said that to me, but I started reading about it and realized that that could be an issue, and the acid reflux was not going away. If I stopped using the acid blockers, it was back in full force, and it felt like it wasn't normal, like it shouldn't be happening. So that's when I decided that maybe it could be fixed.
Mhm. So what kind of medications were you using at that time?
I think I know I used Prilosec. Is that like a once a day thing? I think before that I had used some other thing that was twice a day. And before that I was eating Tums um, nonstop.
Mhm.
So, and any dietary changes or things that, someone would say, oh, this'll help or that'll help. Nothing that I did food wise or beverages or anything seemed to cause the reflux to go away.
Mhm. You mean like special food choices or
Right.
different type
Or
of meal planning?
right. Avoid this or eat that, and someone will say, "Oh, a grapefruit pill
Okay,
will cure it." And
sure.
I didn't go that far, but
Okay, but yeah, right. But I think we can all relate to, um, sort of crowdsourcing from friends and family, things that could be soothing or helpful or make us feel better. Um, and none of those things worked for you.
yeah.
Okay. So, can you tell us what type of symptoms you were having?
Just I guess you'd call it heartburn, just burning in my chest or in certain foods I'd really react to dramatically. But also, I started having, and I'm still not for sure that this was a symptom, but it felt like spasms it right in my chest, like right in front of my heart. And I think, oh, I'm having a heart attack.
Mhm.
But after I had the surgery, I never had those again. So
Okay.
I think it was related.
Yeah, you just gave an excellent example about how a lot of times people who have really significant reflux symptoms end up having lots of heart testing, lots of cardiac testing. Um, and of course, we always want to make sure your heart is okay for everybody, anytime that there's symptoms, that type of feeling in the chest. But when all of that kind of like $1 million testing kind of like comes back
Your
normal,
heart's
or
great.
maybe something is found, but then it's treated, it's addressed appropriately. And yet those particular symptoms, like you just said, like a chest pain, or chest pressure, spasming, it doesn't always go away. And then we don't realize to look at the next thing that lives right in that area, which can be the esophagus.
Yeah.
Yeah. Okay. Were you able to lay flat at night to sleep?
With the medication, I wasn't bothered that much at night. I would take it in the evening or late afternoon, so it seemed to work okay at night. So I didn't wake up with symptoms at night.
Hmm. But if you didn't take your medication,
I would.
you would feel it. So if for some reason, let's say you ran out, what would you have to do in order to be able to sleep?
Well, I'd be back on the Tums, you know.
Okay.
But I guess sleep wasn't really a big issue. It disturbing my sleep.
Okay. Did it disturb any of your activities?
Well, definitely enjoyment of food and
Hmm.
caution about certain foods. Um, to this day, I would never crave a donut because they treated me so horribly. When I
Okay.
had reflux, I was just like, ooh, why would someone want to eat one of those?
Okay. So that was a pretty good trigger food for you.
Yeah, any
Hmm.
things like sweets or just general. I mean, there are certain things like vegetables didn't seem to bother me much,
Hmm.
but any kind of sweet or thing wasn't fun.
Okay. I see. Okay. Yeah, so those are all pretty typical things that you mentioned that I hear from a lot of other people as well. And I think it's really interesting that you mentioned donuts, or desserts, because those aren't foods that we typically associate with heartburn, right? Those aren't like the chili peppers and spicy things, maybe very oily things, certain specific, like tomatoes and certain foods.
Hmm.
So we don't really associate like dessert foods with that. And yet that was an important trigger for you.
Yeah.
Yeah. Yeah. It really, ultimately, it really can be anything. What if it bothers you, it bothers you. But, like in the case of donuts, we don't always remember that they're fried. And so that can play into it. It just is like a treat. That's how we think of it. Yeah.
Or not,
Or
or
not, yeah.
something to
If it
avoid.
trains you, yeah, if it trains you the other way, then or maybe not. Yeah. Yeah. So what was it that made you feel like surgery needs to happen? It's the next natural step for you after what you'd been experiencing.
Well, I think it was the friend who said she had such a huge impact and improvement after the surgery, and spending time with your dad and him talking about the surgery and thinking about long-term consequences of taking a medication that you don't really know exactly what it's doing or how it works or what consequences could be from long-term use. And so It just seemed like the smart thing to do. And I have not had a moment of heartburn since 2012.
Amazing. 2012, 14 years.
Yeah.
Okay, great. So, there's a lot of people that don't believe or have been told um, that that long term of a benefit from anti-reflux surgery is possible. So, what do you have to say to those people?
Well, so far, so good. It's worked for me. The only consequence, and I think it's not a bad thing, I can't throw up. I have
Okay.
not thrown up since 2012 either, because I guess it just makes it tighter. And I'm not even sure exactly what the surgery does, but apparently it makes it so you can't throw up, at least in my case.
Yeah, yeah. It reconstructs the surgery reconstructs the mechanism that allows things to stay down where they belong. And for some people, um, the way that it works for them, it makes it appropriately difficult for things to go back up. And so sometimes that can mean feeling difficult with things coming up for vomiting as well.
Yeah. So
Hmm.
that's not an issue anymore either.
Okay. All right. I can see why that might not be something to complain about. Hmm. Yeah. So what was it like in those initial days after surgery?
It was seemed to be a very easy, simple recovery.
Hmm.
Um, there was there was like one night a few days after the surgery where I felt really uncomfortable, but I didn't know why I was feeling uncomfortable or what was happening, and it went away. So I figured that must not have been a big problem. But I didn't have pain afterwards, really. It was just and I went back to work a couple weeks later, and
Hmm.
it was easy.
Amazing.
Yeah.
How was it adjusting to eating after? We usually keep people on a more liquid diet and have them progress. How was that
Right.
experience?
We did that. I did liquid diet 2 weeks before and a couple weeks after, I think. And I still don't like carbonation that much. I didn't drink any carbonated beverages for years, and I still don't. I just got out of the habit. So I just
Mhm,
drink water. But foods didn't bother me afterwards. I took it
mhm,
easy for a while, like to let it heal and all, but
mhm,
I haven't had any issues with foods or like medications they say can upset your stomach. They don't.
mhm.
So it's just seemed to work really well for me.
That is so amazing. You're saying a lot of things that I know others have a hard time believing can be true. Of course, they would like to be rid of their symptoms and be able to reclaim, their life, basically, the things that they have to change to cope. Um, but sometimes it can be hard to believe that that can happen without a catch or without a downside. But a lot of the things that you're describing don't sound like there was much of a catch or a downside for you.
No, I remember before the surgery, even with taking the acid blockers, if I took ibuprofen or something that could be rough on the stomach, it would be. But since the surgery, I've never had a medication bother me in that way. It just stays where it's supposed to be.
Mhm. Amazing, yeah. So, did you ever have trouble before surgery when you ate with food feeling like it might get stuck or hung up partway down?
Yeah. Yeah, I would and now that I think about it, I do remember that it's just the swallowing multiple times sometimes to get things down, but um, I forgot about it because it
Mhm,
hasn't happened
mhm.
since.
Did it feel like it took time for that to get better after surgery? Do you remember?
I don't think it took that long.
Mhm. Okay. Well, it certainly disappeared, it sounds like, because you don't really remember it being an important memory anymore. That is so cool. It's amazing for me to see someone that is still happy and still, thriving, and part of the um, thing that helps them be able to be thriving in all their different things is having taken care of this issue and having it be a lasting influence for you for so long. That's really cool for me.
It is, and people will say, "Oh, talk about their heartburn or whatever," and I just say, "Oh, I
Mhm.
had that fixed.
Oh, yeah.
It's not a problem anymore."
And what do they say when you say that?
Really? I don't, I usually just leave it at that. If they had questions, and I have told people before.
Mhm.
In fact, I had a coworker that right after I had the surgery started the process of going through the testing, and she had the surgery a couple months later. And
Okay.
she thanked me afterwards.
Yeah. Yeah, for sure. You're a referral source all on your own.
That's me.
Yeah. So you mentioned the testing. So you're referring to the process of evaluating, if the heartburn is what we think it is, and making sure that the person is appropriate or safe for what we think, which is anti-reflux surgery, or are we discovering a different disease process that's giving similar symptoms? And so those are tests like upper endoscopy, esophageal manometry, which is that functional test where we have a sensor-based catheter where you take sips of water and different things, and the pH testing to see how much acid is moving into the esophagus and stuff. So, what was that like doing those tests?
It was very easy. I didn't even think about, I mean, it was just very simple. Nothing was painful, or having those tests done made me even more comfortable with the idea of having the surgery because it showed that I had acid in my esophagus and where it wasn't supposed to be. And like the endoscopy, it was like it was over. I didn't feel like it was a big deal or nothing dramatic about the testing. It was just very easy.
Yeah, the tests are, well, endoscopy is, of course, a procedure, a short same day procedure. And then the other tests actually we do in our office. So that makes it a little easier to accommodate people because it's almost like we're doing it right at home in a way.
Hmm.
Yeah.
Yeah.
Yeah. So, what would you say to someone that is having these symptoms and worried that surgery might cause them more harm than benefit?
Well, all I could relay would be my own experience and how easy it was. I mean, of course, having to go to the hospital and be anesthetized and all that, that has, it's something to think about that you don't want to do every day. But I just felt really positive about the possibility of having that not be a problem anymore. And the recovery was simple enough. I would not discourage someone from taking that step.
Well, Judy, I really appreciate you sharing all of these aspects of your experience and helping us show people what that could be like if they were in your shoes. Is there anything else you would want to share with us about your experience or to other people that also have this problem?
I would say that, I mean, it's possible that someone could just think that heartburn is just normal, that it's something that you just have to put up with. And probably I thought that before I learned about this surgery. And it was such a relief to know that it is something that you can fix. So you can forget that you ever had heartburn
Mhm.
before.
Mhm. I love that. The gift of being able to forget
Mm-hmm.
about it. Yeah.
Yeah.
Yeah. That's yeah, I like that. Now, I just got reminded of one last question that I have because you mentioned to me earlier about an acquaintance that perhaps developed a cancer that might have been related to heartburn. Um, can you touch on that for us?
My good friend's sister passed away from esophageal cancer, and I'm not sure what her history was. You know, I didn't know her then, but when my friend saw that your post about the surgery, she said she wished her sister had had access or known about something like this because she might still be here.
Mm-hmm. Yeah, that's so sad.
It
It's
is very
very
sad.
yeah, it you know, it touches my heart because of course, as you said, we don't know that person's personal history and details, but just thinking that if that was true, if that was the case, and that could be preventable situation, a cancer death from a heartburn treatment is pretty striking.
Very, very striking.
Hmm. Yeah. Well, thank you for sharing that. I
Oh,
think
you're welcome.
an important other aspect that I think doesn't often get connected together, but it definitely
Right.
is connected. And actually, April is Esophageal Cancer Awareness Month, so very perfect example of exactly why we have to care about that.
Well, I'm glad I did.
Okay, well, thank you very much, Judy. I appreciate your time and appreciate you sharing everything with us. And well, we hope we get to see you in person soon.
Okay. Thank you.